I think seeing this today has really given me a different perspective of the services that are involved. I had no idea there was this many services involved, to be honest.
Well, I think at the moment we all look at things from our own perspective. So we talk about acute care, we talk about primary care, but in actual fact, the citizen doesn't really care about those things. They just want joined up services that give them really good outcomes. And that's the exciting thing for us, is to do it in a completely integrated way where the wiring is invisible and all that really matters is high quality outcomes.
Okay, this winter's been really challenging. I think out of all the winters that I've worked in the health service, this has been the one that's really, I think, taken people to the edge. I think staffing from around the economy, I don't feel we've been able to give the care that we want to our patients. And that's why I think this new models of care, I think, are so important to our patients, but our staff as well.
We've historically worked with what's the matter with me, as in, I've got an illness and label. But what we want to move to is what matters to me.
Working within a network of hubs, coming out to general practice, improving communication all the time, which is going to make what we call the patient journey a lot better.
I hope that it feels like one door. So one point of access, one door for people to go through, because let's face it, a lot of people, they don't understand the system that goes on behind the scenes, and they don't understand how different organisations have different roles to play. They just want to access the services that they need at that point in time. So this work means that behind the scenes we can do all of that work to make sure that it is working together, so people get what they need when they need it through that one door.
Right, what I'd like to see is actually mental health workers being involved in the integration teams, being co-located, that we have systems talking to one another. So if somebody turns up at one part of the system, we can look and see actually we know who's involved, we can have conversations with the professionals involved, and we can treat that individual as a whole and not just as separate conditions. And I think this is a really good opportunity to start looking at that.
I think we'll have a lot of more health services integrated with social care and other agencies delivered in localities. So there'll be a smaller specialist provision as more people have their needs met much earlier on.
Now, whilst we're integrating, improving the patient journey, what's key is the way that we pass information from one person to another. Information technology is obviously crucial there. And we'll need to get people on board with being able to share certain health records, etc.
And of course, when you do that, it gives you an opportunity to move to a much more anticipatory type of care system, where we're not waiting for things to go wrong. We're looking at the trends of the information and saying, well, actually, this is going wrong or might go wrong in the future. How do we flag those people? Because they may not be people that are generally well known to the care system.
For so long, we've tried to kind of label people as, you are diabetic, you have a heart condition, and treat people in silos. Trying to treat people as a whole, trying to understand the issues for them as they see it, rather than just the other way around.
This is what we've wanted on the will, and we've got that opportunity now.